lab. I know that Howard Jasper is starting off with doing labor and delivery in her first lab. Since we have it the same day, her and I both on Thursday and Friday for the lab. What we'll end up doing is this week she'll start with labor and delivery in her group, and I'll start it next week, and this week I'll be doing baby. So the lab that I have on my living blackboard is for the L&D, but just download it so you can have it for the lab. This is also going to be something you learn in class too. The nice thing about the first exam is that you're going to know the material really well by the time you take it, because the first exam is going to have to do the quiz. The quiz and the first exam are very similar in the sense of material that you're going to need to know. Okay, so we're going to start with chapter 12 here. And again, it's good to read the chapter because these PowerPoints are really just the highlight of it, you know. The other thing in the chapters, which is nice, is in the back part of the chapter has questions. And then also this book has, you can go and do NCLEX review questions also. If you go to the Point, the website, it's the Point LWW. They have, I always tell the students to review the questions before you take your test, and also do Kaplan before you get your first exam, second exam, and all that, because it will help you, give you rationale, to the answers, okay? So that will be helpful also for you on the exams. Okay. So something called preconceptual counseling. What that is that a person gets counseled. The term recommends that everybody goes to the doctor or their nurse practitioner prior to getting pregnant, if they're planning pregnancy. Okay. What happens is they want to make sure that you're, go through a history of you, finding out if, where you work, is that going to be hazardous to your pregnancy. They'll do a history on your nutrition to make sure you're eating well balanced meals, okay, getting your fruits and vegetables and all that. Also, if you have any kind of, let's say you're on a birth control pill, they advise you to get off it. Sometimes it takes 3 months for you to start ovulating again, so they'll recommend that. Some other medications, like the women who take that Seasonal, which period pretty much for a year. Sometimes it takes a little bit longer for ovulation to occur after you're off of it. Same thing with a shot called Depo-Provera, which is a shot for birth control that lasts 3 months. Sometimes that takes up to 6 months for your body to get back to ovulating. So to go see your, as I said, nurse practitioner, midwife, physician, whoever, prior to getting pregnant if you're planning pregnancy. And this way they'll go over what medications you're on. They'll make sure that they're not detrimental to the fetus. They'll also tell you to start taking folic acid, which is a D vitamin, that they have shown that folic acid actually decreases the risk of having a baby with a neurotube defect. What that is like a spinal bifida, or part of the brain missing. Okay, that's something that doesn't happen that often, thank goodness. But studies have shown if a woman takes folic acid, 400 units a day, prior to becoming pregnant, that the risk of this disorder is lessened quite a bit. Okay, so these are some of the things. The other thing about preconceptual counseling is, let's say you are on high blood pressure medication. Sometimes the medication that you're taking, even if it's herbal, sometimes can be cause effects onto the baby. Okay, negative effects, or I don't know if you ever heard of the term teratogenic effects. Teratogenic, the part is terat means monster. Okay, and they refer to teratogenic effects on the fetus, meaning that the baby, if you're taking medications that can harm the baby, okay, that's called a teratogenic effect. The baby's being formed by it. Or X-rays can cause a teratogenic effect, cause harm to the baby. Okay, so these are some of the things that you might be not aware of, maybe where you work, might be quite hazardous chemicals or something that actually can affect the fetus in a negative way. Okay? So that's some of the reasons why you go and get preconceptional counseling. If you're diabetic and you're on insulin, they don't want you on, or if you're on an oral hypoglycemic or hypoglycemic drug, they usually will get you off and put you on insulin. So anything that might have any kind of lupus, anything that you might have that could affect the pregnancy, it's best to talk to your healthcare provider prior to getting pregnant, okay, and just make sure. So that's what they call preconceptional care. Okay? And you can see here the whole rationale for it is to promote the health and the well-being of a woman and her partner before pregnancy. Sometimes it'll even go over genetics. If there's something that runs in your family, that's a good time to, we'll have you go talk to a geneticist also. It identifies and modifies biomedical, behavioral, and social risks to a woman's health for pregnancy outcomes, prevention, and management. Cigarette smoking, alcohol, all that can affect the fetus. So, again, if you're planning to become pregnant, this would be a time to seek out preconceptional counseling for that. Okay, some of the risk factors for adverse outcomes. The first one, the isotretinoin, okay, is actually like vitamin A, Accutane. Okay. Accutane in pregnancy, a lot of times women will use Accutane if they have severe acne, okay, and it's a vitamin A derivative. And actually, a nurse discovered this years ago when I was in grad school. I remember hearing about this. If you take Accutane or vitamin A derivative in pregnancy to treat acne, it can result in a miscarriage or a birth defect. Okay, so if a woman has severe acne and she's using this medication, they usually want her on birth control so she doesn't accidentally get pregnant. Okay, if she chooses to want to get pregnant, she gets off the birth control pill and off of this Accutane. Okay, because it can cause miscarriages and birth defects. Also, alcohol misuse. No time in the pregnancy is it safe to drink alcohol. A lot of times you'll hear people say, you hear stories about like people who were born in the 50s and the mothers would have cocktails or something. The doctor would tell them to have cocktails to be able to relax if they're a little bit nervous. And then they find that, they don't know how much amount of alcohol is detrimental to the baby. So they just tell you not to have any alcohol while you're pregnant. The other thing that they have is the anti-epileptic drugs. Certain drugs recommended to suggest that before conception, women who are on regimen of these drugs should take a lower dose of that medication. Okay? Again, it might be something to affect the fetus. Diabetes, again, this is preconception. If the woman she has to be really well controlled when she is going to be pregnant, before she gets pregnant. Her blood sugar level should be within a normal range. If she doesn't have it within a normal range, it can cause miscarriage, heart defects, bone forming, all sorts of problems with the fetus if she goes into a pregnancy and her blood sugars are high or very low.
Wait, there, it says it right here. Never mind.
Then we have folic acid deficiency. We talked about that already. That you want to make sure that they get 400 units of it. It says here, demonstrates to reduce the occurrence of neurotube defects by 2/3. So that's a big deal. Okay. Hepatitis B vaccine. Well, this is right from the textbook anyway. Okay, that people are, have been vaccinated against hepatitis B. HIV in New Jersey, it's required that all women in pregnancy get an HIV test during the pregnancy itself. Sometimes what they'll do, and it is required now, it used to not be, required. If a woman comes into labor and delivery and she's never been tested for HIV, let's say she never went for prenatal care, then they will test her, do a quick test in the labor delivery unit so that they'll see if she is HIV positive or not. Hypothyroidism, sometimes that they might have to increase your medication during the pregnancy. Rubella, negative rubella vaccine provides protection and prevents rubella syndrome. If a woman, usually they'll do like we all did for our health here, to see that we're immune to rubella. If the woman isn't, they will vaccinate her prior to getting pregnant. She shouldn't be pregnant for 3 months after she gets vaccinated with rubella, because they're afraid it's a blood virus that might affect the baby, the fetus. And the other thing is that, again, if a woman gets rubella while she's pregnant, the baby will have all sorts of what we call congenital anomalies, meaning cavities in utero, she has rubella, and the baby, again, can have bone deformity, head and face deformity, cardiac problems, and even die in utero. So rubella is a big bad one. Okay. Let's see. Put that. Okay. PKU, which is a metabolic disorder. Okay. It's rare, but again, if the mother knows that she has this problem, there's a chance that the baby can also have a problem. They test the baby at birth to see if the baby is a carrier or has some disorders, so that they can treat it with just even diet and help the baby out. Okay. Obesity, again, you're higher risk of diabetes, for high blood pressure, and then oral anticoagulants. Depends on what you're on. Usually they recommend heparin if your woman is on something like that, an anticoagulant. Because heparin's large size will not pass to the fetus. Okay, there's a barrier to that. And then STIs, which is the new STDs, is basically sexually transmitted infections. We want to make sure that at the first visit they'll test you for syphilis. They'll do a blood test for that. They'll test you for gonorrhea. They'll test you for chlamydia. Okay, they do pap smear also. And again, towards about 36 weeks in the pregnancy, they'll test you again to see that you don't carry it and pass it on to the fetus when it's born. Okay, and smoking is not a good thing, because they say smoking can cause the baby to be born too small, and the baby can be hyperactive as it grows older. And then again, some of the things that we look at prior to her getting pregnant is, of course, immunization status. We talked about any kind of underlying health issues that she might have. Reproductive health care practices, in other words, that she use any birth control. Sexuality and sexual practices. It's interesting, at Valley Hospital, in the last couple of years, not often, but every now and then you'll get a lesbian couple come in, and you sort of, they're not put off, you're sort of like not expecting it, it's like two women, and they usually know the sperm donor, a lot of them, okay? So they're, again, not unusual to see people coming in, or even surrogates, people who hold, a woman can't get pregnant, she has her sperm and her egg implanted into somebody else who carried the pregnancy to term, so you get some of these things that you hear about or read about, we had somebody who was like 45, 48 years old, married, years ago. She married somebody, a younger man, right? And she used, in vitro fertilization to get pregnant. And she had twins. And when the twins were born, she wanted nothing to do with us. It was the weirdest, very strange. Like, she didn't want to see them, she didn't want to feed them. So we had the social worker. What was going on there? Okay. So you see all sorts of interesting, like different things that can occur when you are in the hospital. Nutrition is very important for a healthy baby. Lifestyle practices, making sure they don't do anything that is harmful for the pregnant woman. Psychosocial issues, is just planned pregnancy, does she have support? Where if her husband's in the military, maybe he's not there, maybe family's not around, that could be cause of depression in a woman. Medication and drug use, and then the support system. Again, women who have a tendency to get postpartum depression are women who don't have a good support system. Okay, so having a support system, we're so weird here in the United States when you think of childbirth. When you think about this, a lot of us don't live close to our families. nerves, right? So we have our babies and we go home and we're exhausted, we have no help. When you read about cultures, other cultures around the world, they will treat the woman like a princess after she has a baby, and they will have her do nothing but take care of herself and breastfeed the baby, while the family will go and cook and clean the house for her for 6 weeks. So that's very nice. United States, we don't have that. It's like, what are we doing to ourselves here? You know, it's nice that other cultures will allow the mom time to bond with the baby and also take care of herself while somebody else is working on the house and what's for dinner, you know, and taking care of other siblings who are in the first prenatal visit is usually the woman finds out she's pregnant. You can find out nowadays, like 2 days after your missing period. It's pretty quick over the counter stuff that they have. And usually you'll call and they'll say, oh, your first visit is in a month. You know, unless you had a problem with your other pregnancies, if this is your first pregnancy and you have no health issues, usually it takes about 3 weeks to a month to get a first appointment. Okay. And the person that you talk to the most, I used to run a prenatal clinic, teenagers down Jersey Shore, and it ended up, I was the one they talked to all the time. You know, the physician comes in and out and, you know, does his measurements and, you know, says hello and goodbye. Really, the nurse becomes the person that you are going to be establishing a rapport with the patient. Okay? That's why I went into maternity nursing. I always have a discussion with a friend of mine who's a med-surg nurse, and she goes, all we do on med-surg is give out the meds. We don't have time for all this nicety and talking. We have, this one person told me they had 140 different meds they had to give out during a shift to, you know, they had 6 different patients. So the whole time they're getting the meds out, or they're calling the doctor to order some meds or tell about blood work. And she goes, you don't have time to teach patients anything. You know, I said, that's why I went into maternity nursing, because you can set up a rapport. You do have time to talk to the patient. You don't feel like all you're doing is giving meds. You really don't give that many meds in maternity. You know, so that's the nice thing about it. Everybody has their own, you know, I'm not saying everybody should be a maternity nurse. I'm just saying I like to spend time with the patient as opposed to handing them with medicine when we move to the next phase. Okay, focus on education for overall wellness. Usually, the first prenatal visit, you know, you go over some of the things like, you know, signs, the warning signs, like she has a severe headache, or she has bleeding, or she has really bad nausea that she can't keep anything down for days, like that Duchess. Kate Middleton. She's not able to keep her food down, so she had to go to the hospital and get IV fluids. Detection and prevention of potential problems, comprehensive health history, physical exam, and lab work. Okay, so what happens is the woman will have a whole, she'll get a pap smear, she will get her height and weight, she'll get her blood pressure, they'll test her urine to see that she doesn't have any glucose or protein in her urine. So each visit, she will have that done. So every single time she goes to the doctor or midwife, they will do her vital signs, they will test her urine for glucose and ketones and protein, okay? And then they'll weigh her, okay, each time. And as she goes along, around 10 weeks, 12 weeks, you'll start listening to the fetal part. You're able to hear the fetal part. So we'll start doing that around that time. The first time you're at the prenatal visit, they will have you go for lab work. Okay, so some of the other things that they'll ask you again was why are you seeking the care? You say I might be pregnant. I don't know. Okay. So they'll want to know the date of the last menstrual period. Okay. Signs and symptoms of pregnancy. She says I feel nauseous. I feel my breast is sore. I'm tired. Did she take a urine test or blood test for the hormone that is produced to show that she's pregnant? It's called the human chorionic gonadotropin hormone, HCG. Any kind of past medical or surgical or personal history that you know about, any kind of reproductive history, the menstrual cycle was normal, has she had any problems with her other pregnancies or gynecological issues? Okay, and some other things, you know, again, age of menarche, which is the first time she gets her period, she's now 12 years old, how many days in her cycle, flow characteristics, with heavy, light, discomfort, is she cramping, is she miserable beforehand, and wants to be short on the same time, and use of contraception. Now, how do you figure out when her due date is? And if this is something, it's a test question. Okay, so wake up. It's a test question. All right. So there's something called Nagel's rule, right? And I don't know if you know it or not know the name of it, but you have to know how to do Nagel's rule. Okay. So what we have here is the date of her last menstrual period. So you'll see that as LMP, last menstrual period. Sometimes you'll have it as LNMP, last normal menstrual period. Okay. So you're going to take the first day of her menstrual period. So let's say her period goes from, well, let's say December 1st to December 5th. Okay. You're going to take December 1st, which is the first day of her menstrual period, and what you're going to do is to get her due date, you're going to go back 3 months and add 7 days. Okay, so if December 1st was her first day of her last menstrual cycle, you're going to go November 1st, okay? You're going to go October 1st, and then September 1st, and then add 7 days, okay? So her due date is September the 8th. Minus 3 months, I said December, so November, October, September, so minus 3 months. So plus 7 days, so the first and 7 is the 8th, so that's her due date, okay? Here you have use first day of last normal menstrual period. So we have here, she was November 21st. So then we subtract 3 months, and then we add 7 days. Okay. And they also can, ultrasound is a method of dating pregnancy because it's more accurate. Sometimes people have their dates off too, you know. And you'll see a lot of times doctors or midwives or nurse practitioners will carry this little wheel, and if you can see here, really old. Here, here's this little wheel. Okay, what it does is, you'll see, I'll pass it around. This is like really old. You can start with this one. And we'll pass that one. You can look at this one. It's like, look at it. I've had it for 20 years. Okay, and what that does is, okay, so you take a look here. Little wheels are like cheating items for the doctors and the nurse practitioners and everybody. Okay, so we go from here, we say the first day of her last menstrual period. Okay, so we have, this is September, this is October. So it looks like she's like October 1st. Let's say October 1st, so pointing here. Okay, you see this October here. That's September. That's September 30th, and then it's going 1 over. Okay. She probably conceived, let's say, on the 14th day. Okay. And her due date, go all the way around, is July 8th. Okay. So her first day of her last menstrual period is October 1st. Minus November, August, September, August, July. Add 7 days to the first, and she's due on the 8th. Okay? So that wheel, every time the patient comes in, we always will start, let's give today's date. Today is like the 20th, let's say it's the 30th. Okay? So she's coming in today, let's say it's the 30th, so we'll do the 29th. Okay? And we say to her, when was the first day of the last menstrual period? She's the 1st of October. And today, she is here on the 30th. She is 17 weeks, okay, in about 2 days. So every time she comes in, so we say the next visit is like 4 weeks away. Okay, so then we go. Next time she's got 21 weeks pregnant. Okay, so that's what we use as a little. See here, it'll talk about what things can be done during that time, what tests that are done, okay?
Chocolate.
BPD means biparietal diameter, meaning they didn't ultrasound, they would measure. This is the crown wolf link here. So it's a cute little wheel that gives you a lot of information. Okay, that's why you carry it with you in your pocket all the time on the left.
Sure,
This
good,
again,
man.
we'll be going over this in the lab, but I'll be quick with this now. But we will talk about the lab because that's that, that lab thing I want you to print out. These are terms you're going to hear in the pregnancy area, in delivery. Even if you have friends who are pregnant and all this, these are terms that you'll hear. Okay, the first term is called gravida. Gravida is a pregnant woman. Okay, she's pregnant. So she's a gravida. Okay, gravida 1 means she's pregnant for the first time. Okay, so prima gravida means like premier, first class, first pregnancy. So in that case, this woman here, okay, here is her first pregnancy, she's prima gravida, gravida 1 meaning the same thing, first pregnancy. Gravida 2, we never use this word. We never use it. Gravida 2 means she's in her second pregnancy. Gravida 3, she's in her third pregnancy. Okay, so you get the whole thing. So it means how many times she's pregnant. Okay. A para, so sometimes in a report you'll hear the nurses say she is a gravida 2, para 1. Okay. Para means a woman who has produced one or more viable offspring carrying a pregnancy 20 weeks or more. Okay. So, in other words, so she had, let's say she delivered at 30 weeks, and she's pregnant now. So she's a gravida 2. Her first pregnancy ended at 30 weeks, and so she's a para 1, okay, because she had one birth. Prima para, one birth after a pregnancy of at least 20 weeks. So they call them a climate. So para means that they become a parent, okay? Or about to become a parent. So this person, prima para, is one birth after a pregnancy of at least 20 weeks. A multipara, which they call multips, you'll hear the nurses say that, is 2 or more pregnancies resulting in a viable offspring. And a nullipara means no viable offspring, para 0. So she never got pregnant or she never made it to 20 weeks. Okay. Here is another way of looking at it, and this gives you more information. Gravida is the current pregnancy or how many pregnancies she's had. Okay. Term is the number of pregnancies ending greater than 38 weeks, and usually to 42 weeks is considered term or the due date or the baby's due. And it's going to be, the lungs are going to be mature, so it's about 38 weeks to 42 weeks. And you have that abbreviation. You have G for gravida, T for term, P is for preterm, okay? And that's the number of preterm pregnancies ending greater than 20 weeks. Or viable, but for completion of 37 weeks. Okay, so preterm is premature, and it's usually for the 28th week of pregnancy that's considered. Abortion is the number of pregnancies ending before 20 weeks. So abortion can be either she chooses to miscarry the baby, she chooses to not have the baby, or she miscarried the baby. Then it's the same meaning. Abortion means the same thing, that she either loses the baby on her own, she was not able to hold the baby, or keep the pregnancy, or a woman deciding she wants to terminate the pregnancy. So abortion means the same thing. And then L is living children, okay, that she has currently living. Okay. So following statement, true or false? A multipara refers to a woman who is pregnant for the first time. Okay. A multipara refers to a woman who has had 2 or more pregnancies resulting in viable offspring. Okay, so some of the other things that will happen, again, on the first exam or first prenatal visit is the vital signs, head-to-toe assessment. They'll do the whole assessment. They'll check her abdomen, including the fundal height, right? We'll talk about that. Okay, where's the fundus located? And they'll check her extremities for varicosities, varicose or edema. Okay. A public exam will do. They'll examine external and internal genitalia. They'll do a bimanual exam, so basically they're going to go in and feel where the uterus is, and then on top, bimanual 2 hands will be like, pushing down on her uterus from outside. They'll get a shape of her pelvis. Why they do that is because women who have this gynecoid shape of the pelvis are more likely to have a vaginal delivery. Okay, it's a nice shape that allows the baby to come out vaginally. This one, and this one, pretty much, when you see a test question having to do with pelvic shape, it's always going to be gynecoid. Of every test I've ever seen, perfect pelvic shape to have a vaginal delivery is gynecoid. I've never seen any other question having to do with the shape of the pelvis. Okay. Pelvic measurements, again, they will measure the pelvic area to see, again, if she is able to have a vaginal delivery. Some people who are like 5 feet tall, and, very narrow hips, sometimes they have C-sections, okay? So they try to measure how they think the outlet's going to be for the baby to be able to come out vaginally. And here is an instrument they can use. Again, this is what they're using their hands here just to measure the outlet here. It's the baby's head. There's another, I'll tell you something, no one use, I've never seen anybody use this. I'll be honest with you. But they write about it, but I've never seen it. I've worked with doctors, I've worked with prenatal clinics, never seen it done. But I guess in theory, it can be done.
Is that the baby's head?
Yeah. It's wide enough.
Doesn't look messed up.
The blood work,
Stop that.
I will tell you right here and now, every test that you have will have a question having to do with
Lab work.
with CBC. You have to know what a normal CBC is. And then you have a new textbook in that chapter 12. They have a whole lab thing for women who are pregnant. What is the normal value? So really, I always test you about CBC because CBC is a complete blood test, a complete blood count, really. It's done all the time for anybody, med-surg, geriatric, pediatric. That CBC is done as a routine test to see if you're anemic, to see if you have an infection. So it does show a lot of information if your platelet count is correct. So you'll have that. And the other thing I noticed, we had a meeting last week, there's going to be 2 neg questions on every test. Okay? Just so you know that. Just because we've got the outlines for what they test on NCLEX, so we're trying to keep the outlines similar
You have a lot of men.
NCLEX tests here. So these are 2 neg
Like 8 questions.
questions on each test. Okay. So urine analysis. I think this is the first prenatal visit. They'll have
My
urine
sister
analysis,
very good.
complete blood count, blood type, RH factor, rubella titer, hepatitis B, surface antigen, HIV for VDRL. Now VDRL is RPR. These are tests for syphilis. Okay, and that's always a test question. Which or the following are tests for syphilis? VDRL and RPR are both tests for syphilis. Okay. They'll do cervical smears. What they'll do is they'll do gonorrhea smear. Okay, chest and the cervix area. They'll do chlamydia to see in the cervix. They go to those areas, the area of the cervix, where they'll be able to do smears to test for gonorrhea, chlamydia. Okay. The test to see if you have cervical cancer. Okay. And then for the blood test, it would be syphilis is the blood test that we use, or HIV also is another blood test that they can determine if you have that or not. Ultrasound, okay, again, sometimes they'll do it if the woman doesn't know her real dates of her last menstrual period, so they'll get age or gestational age they'll get from that. Okay. And then the visits, the follow-up visits. In normal pregnancy, she has no health issues, okay? She goes every 4 weeks for the first 28 weeks of her pregnancy, okay? So let's say she's 8 weeks now, she'll have another appointment 4 weeks from now. If she has a problem in her pregnancy, she'll come more often, okay? Or a problem even before she got pregnant, or a problem in her last pregnancy, her visits will be much more frequent. So every 4 hours for the first 28 weeks. After that 28 weeks, it's going to be every 2 weeks, from 29 weeks to 36 weeks, and then every week from 37 weeks on. Okay, the pregnancy usually ends around 40 weeks. Right. High-risk problems happen more often in the last month of pregnancy. That's why they want her to come more often. Okay? And then, as I said, follow-up appointments would be the weight, the blood pressure compared to what she was the first visit, urine testing for protein, glucose, ketones, nitrates. They'll measure her fundal height, meaning how high is her top of the uterus. They'll ask her a question about quickening. Have you felt the baby move yet? So the term quickening, think of feet going real quick, all right? The feet are moving. The normal time for the woman to feel the baby move for the first time is about 16 weeks in her pregnancy to about 21 weeks in her pregnancy, or 20 weeks. Okay? If she's been pregnant before, she knows that feeling. So she might feel it at 16 weeks. If you're pregnant for the first time, you think it's gas, and it's actually the baby moving, but you don't know that because you're pregnant for the first time. So usually you start feeling the movement between 16 to 20 or 21 weeks gestation. Fetal heart, usually around 10 to 12 weeks, they can use a Doppler that magnifies the sound. A regular stethoscope will not do. Okay? And then you start teaching her warning signs of pregnancy, if she's bleeding heavily, vomiting, headaches, swollen hands and legs, that she should call her doctor. So the following statement, true or false. A woman who is 24 weeks pregnant would arrange for a follow-up visit every 2 weeks.
False.
Okay, so this woman would have follow-up visits every 4 weeks until she hits 29 weeks gestation. And then that's the end. That's the end for this today. How's that? You awake? Okay. This is, time is really, I realize